Welcome to this first lecture on acoustical quality, in which you will learn about reception of sound and health. The acoustical quality of a space is determined by its sources of noise or sound, the distribution of the sound in the space, and the way the sound is received and interpreted. Let's start with the receiver. For hearing, we have our ears. A sound enters the external auditory channel, setting the eardrum and the ossicles in motion, which transmit these vibrations to the fluid of the inner ear, where nerve impulses are transmitted via the 8th cranial nerve to the brain, where it is interpreted. The eustachian tube takes care of the pressure balance. The inner ear also contains the equilibrium organ that acts independently of hearing, activated by acceleration in space and by the rotation of the body controlled. While the equilibrium sense is sensitive to low frequencies, vibrations, the auditory sense is more sensitive to higher frequencies, hearing. We know that noise has been associated with direct stress reactions such as temporary or even permanent hearing loss. It is also known that noise effects do not only occur at high sound levels, but also at relatively low environmental sound levels, when certain activities such as concentration, relaxation, or sleep are disturbed. Annoyance seems to play an important role in this mechanism. If we look into that anti-stress mechanism a little further, we can see that in response to various stressors, psychosocial and physical, an increase of secretion of anti-stress hormones can occur. On the short term, adrenaline is produced and the body is prepared for action by producing noradrenaline. If the stressor is limited in time and perceived intensity, in due time the balance is restored. However, with prolonged stress, chronic stress, production of anti-stress hormones such as cortisol is increased, and a chronic imbalance in the hormones released during stress can occur. It has been proven, although simplified, because there are other hormones and reactions involved, that cortisol plays an important role in the health effects of this chronic imbalance. High cortisol levels contribute to changes in carbohydrate and fat metabolism and can lead to anxiety, depression, and heart disease, while a low cortisol production can lead to fatigue, allergies, asthma, and increased weight. Effects of exposure to noise depend on intensity and duration. A single exposure to an extremely intense sound, such as an explosion, may produce a severe and permanent loss of hearing. Repeated exposures to sounds in excess of 80 to 90 decibels may cause gradual deterioration of hearing by destroying the hair cells of the inner ear and possible subsequent degeneration of nerve fibers. Also, a gradual decline of hearing function usually starts after the age of 60. And that motion sickness can occur when sensory information concerning body orientation and movement is inconsistent and can include breathing problems, yawning, a sensation of warmth, disorientation, nausea, and even vomiting. Vertical oscillation of the body at low frequencies, for example when a building is vibrating from the wind, can be one of the causes. To summarize this video, the different sound and vibrations received by our ears are fundamental for hearing and have an effect on our equilibrium. Both moderate and high sound level exposures have been related to several diseases and disorders. Thank you for watching.